Glory be to God.
Hallelujah. Welcome. Welcome to Medical Mondays with Dr. O. Welcome to another night of learning. And tonight, another night of learning critical information that pertains to all of us because we're all getting older. We're not aging, but getting older. And it's important to know things that would just aid the process smoothly. I'm Dr. Tony Okpesomi, a family practitioner who also treats HIV and addictions in Maryland. I host this program, and I'm always excited to be here Monday nights to learn myself. Tonight we have one of our Medical Mondays with Dr. O family member, Dr. Matilda Lola-Charles, who happens to also be my sis. So she'll be telling us about just getting older nicely. I'm going to defer to her to complete our introduction and topic for tonight. Dr. Matilda, the floor is yours. So if you want to share your slides, that would be great. All right. Thank you so much. Thank you, ladies and gentlemen. Thank you for coming to contribute to this topic. It's not just that you're coming to listen, you're actually coming to contribute to it because this is something that concerns all of us. And I'm sure at some point in our lives, no, not really in our lives, at some point in the course of our days or weeks or months, we would have reflected on how will it be as I'm getting older, or we come across an old person and then we think of ourselves, wow, how will I be if I get to that situation? And I run a healthcare company, and we provide for staffing for the elderly. I'm sorry, please excuse me. Okay, just trying to wait for the noise. Yeah. Yeah, so I provide
Would
you
like to
staffing.
share your slides?
Yes, I will.
Okay,
I was just going to, this is not on the slide. This is like introductory.
okay, okay.
Yeah. So but I can do that while getting to the slide. Yeah, so here's a slide.
Yeah, and I'm actually sorry.
Mhm.
The
Okay.
the topic for tonight, I danced
The
around it,
topic, oh,
is
the to
aging is inevitable. Do you have your plan in place?
yes, yes. Aging is inevitable. You have your plan in place. And as I was saying, um, we are all aging every day, and sometimes we stumble on people who are much older, or we have the opportunity to help the elderly that we have, and then we reflect on ourselves. What will it be when I get to this age? So let's get into my slide. Good evening, everyone. It's an honor to speak with the distinguished gathering of professionals in the diaspora. Today, we will address a reality that touches every one of us equally: aging. It is inevitable, but how we experience it depends entirely on whether we plan for it or not. The question before us is simple: do you have your plan in place? So, just like I was saying earlier on, we reflect on this every now and then. Um, I come across the elderly every day because it's a line of my work. We provide care services for the elderly. So I come across them, and it's always a point of reflection for me. as I get to interact with them day in, day out. Yeah, so I think I'll just jump straight to my slide. And yes, let's see. I will go to the slideshow. So yeah. All right. In this presentation, I have some objectives. My objectives are that we will understand the global landscape of aging, that we'll be able to compare elder care realities in Africa, Europe, and the United States. I just chose on the three blocks of continent to make the comparison and study. I could have extended to Asia and the rest, but three was enough, to have a fair comparison. And then the other objectives include exploring the unique challenges facing the elderly in the USA, and especially the elderly immigrant communities in diaspora. We also want to begin constructing a practical and meaningful personal aging plan. And I believe we all don't have it. My goal is not just to inform you tonight, but to empower you to take action. There is a demographic tsunami in the world right now. The world is getting older and is getting older fast. In Europe, more than one in five people is already over 65 years of age. In the United States, older adults now number over 60 million out of 348 million. As at 2025, these numbers I pulled out for 2025. In Africa, older populations are rising as well due to growth. Aging is not something happening to other people, it is happening to all of us. I know when we're much younger, in the teen or early 20s, we looked at old people like the other. We see things happening to them and it looks so distant. But at this point in my life, it's no longer so far away. Aging is guaranteed for sure. Planning is optional. Failing to plan is planning for crisis. There's nothing we can do about aging. Every day adds on. Every day adds on, moves us, further ahead in our ages. So aging is a constant. It's on. But planning is optional. If you fail to plan, you have just planned to fail. Let's reflect on this. Where do you expect to age? Just for a second. Where? As in location. Where do you expect to age? And realistically, who will support you when you can no longer help yourself? Because it will happen. And do you have a written aging plan? Not just something in the memory, something thought about, but something written. Tonight is an invitation to change that. Culture shapes how we age. African cultures emphasize family care. Europe leans on public systems and social welfare. The United States values independence, but relies heavily on expensive private care. Where you live will shape how you age. Let's compare the elder care systems in Africa, Europe, and the US. Africa is family-based care, very limited formal services, limited care social services, and all that. In Europe, they have a strong welfare system, that is provided by the state. In the United States, they have high quality medical care, but it's fragmented and costly. And the long-term care is very costly. We must prepare for the system that we are going to age in or we are aging into. Whichever system you choose, whether it's Africa, Europe, or the United States, we must start now when we can make decisions by ourselves to prepare. Let's look at the individual continents. The European elder care is strong, but it's strained. It's strained because of the demographics. It's strained because of the increase in the population of the elderly, the high population of the elderly. There is low birth rate, and the low birth rate plus increased longevity challenges sustainability. Systems are also evolving under the demographic pressure. Europe is resource rich in elder care, but those resources are heavily under pressure as at this moment. The African diaspora experience. Oh, sorry, escape a slide. United States. The world-class healthcare, the United States has a world-class healthcare, but it's the most expensive and is inequitably global. It's inequitable globally. There is no universal long-term care coverage. Medicare is limited. Medicaid requires you to be in a financial hardship. Like you have to spend all you have before you can qualify to have Medicaid cover your long-term care. Private care is costly and varies widely in quality. That is the truth. Private care is not only costly, it's almost like the more costly or the less costly you get the care, the less the quality of the care that you receive. Unprepared families face overwhelming burdens. Without preparation, it can be very devastating. The African diaspora experience. Typically, the African support aging parents in Africa. They support the parents and other family members that are aging. They give emotional support, financial support, and medical support. While they are doing this, they are also preparing for their own aging in the countries where systems are very complex, like in the States, like in Europe. The middle age, as I would call them, fall into the category of the group that carry two generations on two continents. They have children who are most likely between colleges and just young children starting families. And then they are carrying, and these children are essentially abroad. And then they carry their parents that are at home in a different continent. I think the generations of those of us who fall between, I want to say between 50 and 65, 70, we carry this burden so much. We are shouldering our children in and out of colleges, and we are shouldering the issues of our parents. And oftentimes we actually neglect ourselves. We are busy taking care of others. And while we are planning for others, please ask yourself, who is planning for you? We have 5 pillars of a personal aging plan. I really want to encourage everyone to have a personal aging plan. It's a shame that although I am in this industry, working in this industry every day, I really did not sit down to have it in writing what my aging plan is until I did this research. And so I want to really invite all of us to please sit down and draw up an aging plan. 5 pillars of a personal aging plan. 1, health and function. We have to make every effort to put a plan in place to preserve your body and your mind. We will get to the details of each of these pillars shortly. The second pillar is housing and environment. Where do you want to age in place? Where do you want to spend your aging years? And how do you want to spend your aging years? Pillar number 3, money and legal. What is the state of your financial readiness? And do you have the essential documents in place? Pillar number 4, care network. What is the network that you have in place that will make up your support system? Who will support you? Pillar number 5, meaning, values, and legacy. Meaning, values, and legacy touches on just what it is, the meaning of life, what is the worth of your life, and what is the value. And we worry so much about what we have to accomplish, what we have to achieve and do and put in place for our children, inheritances, and all of that. While we think and plan these things, and I know some of these subjects have been discussed on Medical Mondays, we should have these things in writing and in place. Let's explore the 5 pillars. Pillar 1, health and function. Health is the foundation of aging well. Your habits today determine your mobility, it determines your cognition and independence tomorrow. Please, let's just reflect on that. Health is the foundation of aging well. Your habits today determine your mobility, your cognition, and independence tomorrow. My mother-in-law used to say something like, let your mind be at peace. And I believe that's what she meant, because she would say something like, something like that. I believe she meant, let your mind be at peace. And she strongly believed when your mind is at peace, all is well. But we need to do a little bit more for our health and intentionally do more to ensure that we are keeping our health in top form, so that our mobility would last for us, that our cognition will last, and these 2 things will really enhance our independence in our aging years. Ask yourself this question: when was your last full checkup? When was your last full checkup? And how often do you do this? I defer that answer to the physicians in the house to tell us how frequent we should be doing that. But it is so important that we should do our checkups even when we are feeling well and there's nothing wrong. You know, they say when there is peace, prepare for war. Do you know all your vital health numbers, like blood pressure, blood sugar, cholesterol? Can you tell at any point in time where your numbers are? Yes. Are we prioritizing sleep, movement, mental well-being? Prevention is cheaper than cure. Pillar number 2, housing and environment. Where will you age? There was a time that people who lived abroad would return back home to go and retire and live quiet and simple life and are happy. I'm not so sure now. And so if you make a choice where you want to retire, where you want to stay in your aging years, you have to take several things into consideration. If staying abroad, is your home safe? Safety is so critical. And is the home adaptable for aging? Is it adaptable? Can it be modified to reduce falls? Because falls is a very common thing in aging. Is your home adaptable? That is a critical question to ask, to check. If retiring in Africa, is the healthcare capacity of the town or the city or the state or the nation where you want to age in, is the healthcare capacity sufficient for chronic conditions? Or will you put yourself in a situation in which when there's a chronic condition, they have to rush you to find the next flight to take you out, to get proper treatment? And that is very, very risky, as we know. One of the things to consider if you choose to retire in Africa or to age in Africa is who will provide your day-to-day care, health care, home care. Home care may be accessible. I mean, it used to be accessible before. I do not know entirely what it is today. It's probably more accessible to get home care over there than in America, for sure. But these are things you have to take into consideration, because that sister that you may be banking on may also be growing and may get married and leave home and may not be available. Or that niece or that nephew may also be having plans for their lives to get out. Like they say, Japa, they may be getting out. So be careful who you have thought about, selected to provide your care. You want to make sure you have put a very reliable, foolproof plan in place. Your environment must support your safety and dignity. Pillar 3, money and legal preparedness. Hope is not a financial strategy, LOL. We cannot hope our way to the bank. We cannot hope our way. So aging requires resources. It's just like having a newborn. You have a newborn, you cannot just hope to raise that baby. The baby requires resources. Aging requires resources, requires a retirement income that would be steady. It requires savings, requires to be ability to meet the healthcare costs. It requires preparation for long-term care, especially if you're beginning to lose your independence or ability to cope with your activities of daily living. Everyone should have a will, a durable power of attorney, a healthcare proxy, an advance directive. Sorry about that. Updated beneficiaries on all accounts. Periodically, you have to visit your, take a look at your account and make the changes that you need, because tomorrow is not guaranteed. If incapacitated, who will decide for you? No, these are the kind of questions that if somebody asks you casually, you'll be like, oh, God forbid. But it's a real thing. Well, it's a real thing. Aging is real. And oftentimes, people get incapacitated physically or even mentally. Who will make decisions for you? Pillar 4. No one ages well alone. There's a very high incidence of loneliness among the elderly. No one ages well alone. It's one of the reasons why retirement communities make huge money from their residents because they are creating communities that would provide the social interactions, mental, physical, that this elderly needs for thriving well in their aging years. Your network should include family, friends, faith community, neighbors, healthcare professionals, legal advisors, financial advisors, care managers, agencies, and caregivers, potential caregivers. You should name the actual people who will support you. You should have your own circle of care in your books. Like, these are your circle of care providers, so to speak, in case something happens. Pillar 5, meaning, faith, and legacy. Aging is a spiritual and emotional journey. Ask yourself, what does a good old age look like for me? What does sometimes they would say ripe old age. What does a good or ripe old age look like for me? What values will I pass on? What values do we want to pass on? Apart from all the hustling and bustling and making of money and being such great experts and paying bills, what values do you want to pass on? And are you sure you are passing them on? You're putting them in place right now? How do you want to be remembered? How do we want to be remembered? How do I want to be remembered? Legacy is not only what you leave behind, but how you live today. We have a case study of Uncle Kofi. Uncle Kofi is a 72-year-old professional who has lived in the US for decades. His adult children live in different states of the nation. They are successful. Life is good for Uncle Kofi, but Uncle Kofi has no aging plan. He had no aging plan until he had a mild stroke. And a mild stroke led to crisis-driven decisions. His family, the children, all suddenly struggled with decisions about care, about finances, about living arrangement. Now that he had a stroke, who's going to watch over him? A child in Chicago, a child in Michigan, a child somewhere, Rhode Island, and everybody's busy with their own lives. And Uncle Kofi needs help. But Uncle Kofi did not put any plan in place. And the children are now pushing it at each other. You go, I will come after. They are pushing at each other. And of course, this decision is laden with financial responsibility as well. Because there was no planning in place, totally, the circumstance of Uncle Kofi dictated the outcome that he got. Planning is not for the old, it is for the wise. I put together here a few simple steps that I really want to encourage us to do in 30 days. Our 30-day aging action plan. To make this practical, I'm inviting you to commit to 5 simple actions within the next 30 days that you will do for yourself. I will do the same for mine too, for me. I want us to schedule a full checkup. I want us to sit back and decide, where do we want to age? And why, really? Where and why do you make that choice? I want to encourage that we have an honest conversation with our children, our spouses, our family. I want us to create some documents, put documents in place, legal documents, financial documents, secure these things. I want us to review one aspect of your financial plan for aging. Just put a plan, a financial plan for aging, because it's so critical. Everything depends on it almost, apart from God. Let's do small steps. Let's take these small steps today, because if we do, we will prevent major burdens tomorrow. My closing thought. Aging is certain. A good old age is not guaranteed. It must be crafted. Traditionally, we honor our elders. As professionals, we must prepare wisely. We cannot have preparation just in our thought, in our mind. We must be intentional. May we all age with wisdom, dignity, and purpose. Thank you for listening.
Wow. Wow. Thank you. I don't think I've heard anything so detailed about us getting ready to age or for aging. Thank you so much for that robust presentation. I have questions, but Madam CEO takes the floor. She won. She has her hands raised. Kindly ask your question.
Thank
That's
you,
our
ma'am.
Mama at NAPAC. Welcome, ma.
Yeah, thank you, ma'am. Dr. Commissioner Popple. Hey, I apologize. I was driving. I didn't see the name of the presenter.
Dr. Matilda.
Dr.
Matilda
Matilda.
Lola-Charles.
Okay, I think she's been with us before, right?
Oh, yeah, yeah. No, she hasn't presented. Yeah, she has. Partly. But she's always on Medical Mondays.
Yeah.
She's family.
Dr. Matilda, thank you so much for a thoughtful presentation. I think that you broke down a very complex topic. And with the 30-day challenge that you gave us, it's you make it practical and empowering. If, with all due respect, if you don't mind, please, I just want to add one more thing to the plans you gave us, because this is what we encounter a lot in our community. People also need to decide where they want to be buried, because death is inevitable. Every time somebody dies, they have to do committee of friends trying to raise money. You can pay for your plot. Decide whether you want to be buried here, or you want to be taken back home, and start to make plan for that, so that your loved ones are not emburdened with this cost. This is something that we need to, but the older you get, the more expensive I think it becomes. So, but it's affordable. Burial insurance is affordable. If you want to be cremated, let it be known. Also, in addition to what you shared, because I had I had started my own plan. It's just I've been adding different things to it. But one of the things, just to elaborate a little bit about I think I don't remember if it was pillar number 1 or pillar number 2. Um, Something about, was it pillar number, something that has
Don't
value,
worry about the pillar number. Just, yeah, say,
uh-huh,
yeah,
something that
yeah.
has value and your legacy. And I think that is important to be able to clarify what are the things that are important to you, because everybody will know what's important for you to take care of you, but important to you, whether you like music to be playing in your environment wherever you are, depending on what level you are, whether you want to be dressed, or whether you want your lipstick to still be on even if you're not able to speak, like your red lipstick, whether you want your nails polished, how you want to be seen, how you want to be presented. Those are things that I think we also should consider, especially for women. But if I can do a quick plug in terms of where you want to live or where you want to retire, you did, and thank God that your presentation included both here and in Africa. I am a CEO of an organization called Bridgeport. We are currently evaluating housing in Nigeria, to present to professionals in the diaspora community, because there are certain lifestyles and structure that we already used to here. And those are the things that the community we're creating in Nigeria will provide for you. You talked about, making sure it's accessible. Some of all the key things, making sure it's fall proof. Yeah, we are in a position to provide you resources, whether it's housekeeping, whether it's au pair, whatever it is, that's what we're talking about. But we will be coming back, and I'm glad you mentioned it, because you gave me a good inroad to be able to ask Dr. O to present Bridgeport, because this is part of the support we need as we're transitioning from our age right now to the next age. To the glory of God, we will age gracefully, but we need to start making plan for all those different tenets that you talked about. Where do you want to be buried? How do you want to be aged? Where do you want to retire? These are all critical decisions, in addition to frequent healthcare. So thank you, ma'am, for a fantastic job.
Thank you. Thank you. Please be
Thank you
sure
so
that
much.
what you are setting up, Bridge Care, be sure that you have
Bridgeport.
Bridgeport is positioned with proximity to healthcare and social amenities as well.
It's a community. Yes, it's going to
Yeah,
have all of those: shopping,
very good.
everything, dry cleaning,
Very
everything
good.
you need.
Very good.
Thank you.
Fantastic. Thank you so much. I just want to thank you again for that presentation, because you took it easy. You didn't rush us. We were able to follow. This is very important, and it's a subject that people don't consider. But I want to say something before, I call on our Dr. Khadijat, that is camouflaging as Wemi Moy, in there.
It's for a different Zoom. My
No,
bad. I didn't get a
no,
second
don't
to
worry
change it.
about it. No, I got
Yeah,
you. I got
thank
you.
you.
So, before I defer to her, I just wanted to say that younger folks need to start this now. for some, it's never too late to start this planning. Never too late. But the
Too early.
earlier you start, you'll be surprised at the huge benefits later. It's more beneficial to start early than later. So this is really not conversation for older folks alone. It's for everyone. That's the point I want to make. So, Dr. Khadija,
Yes, yes. Good evening.
camouflaging Wemi Moy.
Yes, my face real quick. I'm behind the wheels. All right. Thank you so much, Dr. Matilda, Dr. O. This is greatly appreciated. Now, for Dr. Matilda, this presentation was well thought out, and it seemed to me like a sister-daughter combo presentation to what I've been meaning to come here and share with us. Aging as much as inevitable, we know aging and then, we're going to die, just like Madam VP just retreated, right? Planning for this is for every single one of us. There's no Methuselah on anywhere that I know. I don't know, maybe in the books. Now, planning for this, quite a few things you mentioned that I just wanted to corroborate with. Like you talked about when we age and then where we want to age, whether in place, whether in a nursing home. Why people end up in nursing homes is the example of Kofi, Uncle Kofi, because there was no plan. If you plan for this, you can age in your own home and nurses come to take care of you. You have financial plans to do that, right? Otherwise, if you're thinking, oh, Medicare, Medigap, Mediwho, they're not going to cover it. For them to cover it, there's what we call spend down, meaning you have to have no more than $2,000 or thereabout in your account for Medicare to cover nursing home care. Now, with financial literacy, independence, and all that, Dr. O did attend an event that I put up July this year. Empowering our youth, like she said, it starts from youth. That way they understand it. If they did, Uncle Kofi wouldn't have suffered, if the youth knew about it. So there's a lot more we need to do within our community. For me, I do give back to the community in terms of this education. I know Madam VP had said I need to come on here. Most Mondays I'm behind the wheels at this time, but I'm looking at somewhere around the end of December if this is still on, otherwise maybe into early next year, God willing. Quite a few other things that I need to buttress here also, but honestly, I won't want to take much of our time. But thank you so much, Dr. Matilda again, and VP Dr. O. You said everything correctly. Thank you so much for allowing me.
Thank you.
Thank you. And we'll look forward to having you because you're right. It's a conversation that would have been, very, very synergistic with this, but I'm sure you will do an excellent job when you do come to share with us, very soon. This year, December, Christmas and New Year, geez, it's very interesting. So the last 2 weeks, we will not be meeting because of Christmas and New Year. But we'll pick up again, I think it's January 4th or 5th that we'll resume. But we'll be here next week for a conversation we all need to partake in. Very charged, sensitive conversation, where people don't want to touch, where they don't want to go. We touch it on Medical Mondays. We actually go head on and tackle it, discuss it, and get resolution. Next week is going to be one of those. So, our very able pharmacist also, Mrs. Bumi Daramaja, you have the floor.
Thank you, Dr. O. Always a pleasure.
Thank you.
Appreciative, for being here. Dr. Matilda, what a great presentation. Very well needed. And a lot of, I mean, I can almost assure you that many people have heard this and they just put it on, they just set it aside. But it's good that, we keep bringing this up every time. But what I wanted to say is that the age that we're in right now, people don't realize that, if we are not making plans, I look at it as we are just being selfish and self-centered because we are leaving our children for chaos and problems. That's where you see family members fighting over stuff because nothing was planned. And, like Dr. O was saying, and you were saying, if you've been in healthcare, you've seen just about everything. People come and tell you, what's going on, what happened, when their loved ones or their older, their parents get sick. And they start fighting on who's going to take care of who, and then laying blames. I remember, when my dad passed, my dad didn't leave any will. He just said, well, your mom is there. I don't have anybody else. I trained you well and things like that. Thank God, that he had children and a wife that we didn't have to fight. And my mommy will be 89 in January. 6 years ago, she made her plans. How she like everything that you stated, like how she wants to be buried, what she wants to wear, whether it's bag she wants to she wants to hold when she's there, or shoes, everything. And every year she relays everything, and we all know exactly what she wants. So by the time that she goes, we don't have to fight about anything. We don't have to argue. Even if she gets sick, we know what she wants. And I have done the same thing. And if everybody just start thinking about that, and think, when you hear things and you keep saying, oh, that wouldn't happen to me, I'll do it next week. Like you were saying, Dr. Matilda, tomorrow is not guaranteed. Anything can happen anywhere, and it will just cause chaos. So thank you so much for bringing this up. Thank you, Dr. O. Always a pleasure.
So I truly was focusing on aging, which is really the process. There is the end of life chapter, which I just thought I would save it for another time. I mentioned to Dr. O just at the beginning that there is a separate chapter that I just thought that would be a chapter for another day if that day comes. There's a lot that goes on with the end of life preparation. So for this moment, my focus was preparing, putting the preparations in place so that when your knee starts hurting, or when you can no longer, you are beginning to forget the things you used that used to be very easy to remember. You are prepared for the process. Yeah, there is a chapter on end of life. Yeah, but thank you for the contribution.
Yeah, I know. I look at that as part of aging.
It is. That's where aging ends. Aging stops. Yeah. Yeah. Yeah, okay.
I can't wait for that. She did say that in the beginning that, this presentation is just part, and in the future we'll deal with the other half of it. I can't wait for that. It's very, very important, critical. We've talked about some of this, that end of life, situating yourself, getting insurance, long-term care, and all of that when Eric came on. But we need to revisit it. Dr. Khadijat.
Yes, thank you
Have you
for
had
allowing
this
me
again?
back. You
Yes.
see, every chapter, Dr. Matilda, like you said, every single chapter, as important as they are, is how sensitive we think they are, and they don't need to be discussed. And like Dr. Bumi said, we hang them up somewhere. Planning started like yesterday for almost every one of us here. We're guilty of it, including myself, until some information came clear to me. A lot of this information, we need to keep repeating it. Chapter 1, the end of the chapter, we need to keep reiterating it. For example, like I think it was Madam VP that mentioned it. When people die, we run to GoFundMe. It's so unfair, like Dr. Bobby said. End of life insurance, you can get $50. Save yourself. You might be gone. A lot of people think, oh, I'm dead and gone, and they can take care of it. It's so unfair, the burden, the chaos. And when you don't have a will is another part of it. When we actually age, we get old and then we're poor. It's not the best of it either. There are ways we can, rather than, we run the hamster wheel, the first half of our lives, let's assume is a century. By the age 50, we forget about the second half of it, so we don't have plans. All of this is chapter by chapter, peeling it like onions that we need to keep addressing. Thank you so much for this, family, Dr. O. We appreciate everything you're doing. Thank you so much.
Thank you. We
Thank
can't
you.
wait for you to come build on this.
Yes, ma'am.
Thank you.
Yeah.
Madam CEO, you have the floor.
Thank you, ma'am. So I just wanted to add, that, Dr. Matilda did a great presentation. If I may just add one more thing. Yes, it's talking about aging in place. For me, it's more about dignity, preserving your dignity. Because she said something in Yoruba that her mother-in-law says something, you have peace. When you take care of this, you have peace of mind. Yes, you have peace of mind, you have clarity of instruction, and your dignity is preserved instead of people running around trying to figure things out. But once we complete the 30-day plan, I want to encourage everybody to have it notarized. That is the beginning of you having your plan, because it's within your control, if you save it on your desktop, to update it once every situation changes. But at least you have the initial one, you have the original one. Have it notarized so that it is a tenable document. Whatever anything happens, nobody can predict tomorrow. But I pray that all is well with all of us. Thank you.
Thank you so much. Thank you for bringing that up again, Madam CEO. I'm going to get that 30-day plan from Dr. Matilda and send it out so that, for people driving, for people who did not write it down, are not in a place to write it, so you can have it. And it doesn't matter what age you are. Please trust me. Things are happening these days that are so disturbing. May the Lord help us find out and figure out why younger and younger folks are developing cancers and are dying. A lot is just happening. We had a young girl traveling from Europe to Nigeria recently in the last 2 weeks. While on transit, talked to people at home that she's now boarding the plane for the final stretch of her travel, and she slumped on the plane and died before landing in Nigeria. 30-year-old. A lot is happening. There's no age that is too young to start. In fact, a conference that I went to, the youngest person there was 18, and she was doing amazing already. Had herself set up, actually was in business, helping others to understand the reason to put their lives together. So I'll send that out so that we all can come up with our plan, what we want. And when the time does come, because it will come for everybody, life will be easier for the ones we leave behind, and our wishes will be respected and served. I like when we share personal stories. I'm grateful that I went home to Nigeria one year, I think it was 2016 or 2016, around there. And just sitting with my dad, I just was asking, Dad, when time comes and the Lord calls you home, where do you want to be buried? What would you like? And all of that. And I asked the question and recorded him. He went home to be with the Lord at the age of 90, 2 years or three after, in 2018. And that recording saved the day because the family, when Nigerians understand this, wanted to bury my dad in our compound in Abeokuta. And the man had decided he wanted to be buried at the African church burial ground. So I announced that to the family and I said, would you like to hear the recording? They said, it's all right, it's all right. And so that, I didn't even ask my mom. I just did a double grave right there and then because they were so close. I'm like, that's the most reasonable thing I can think of. And she was cool with it. So it's important that we do this for ourselves. If I didn't ask my dad then and know exactly what he wanted, it would have caused some family rifts and arguments and all of that. And that's not even touching the finances, like Madam CEO said. It doesn't. But even now, while we're still alive, like Dr. Matilda presented, it is important that we get our health together. Prevention is always better than cure. Physical, mental, especially removing the stigma from mental health. A lot of people suffer from depression, from anxiety, um, even psychosis, and refuse to get care because of the stigma attached to mental health. It needs to be taken care of. There are medications and counseling interventions that would cause one's lifestyle to be fantastic. So while we're here, we want to live a healthy life. Dr. Matilda, talked to us about that, about getting a wellness checkup or wellness checkup, as people call it, different ways. And she deferred to us physicians on the platform to suggest when. I would suggest that you have your annual physical exam. There's a debate actually on that now in the medical arena that should we be getting it and how should we be getting it and stuff. But it is important, in my own opinion, to get checked out at least once a year, get regular blood work, make sure that things are in order. Some people have things like diabetes and don't know they do. The blood work will show that. People have high blood pressure. It's a silent killer with no symptoms. If you don't check it, you won't know. So when you go for your annual checkup, all these things will be checked. And if there is a problem, then it can be identified and treated. High blood pressure, for instance, people don't know they have it. They're going about their daily care and all they're doing. And all of a sudden, without any warning, people can have a heart attack, they can have a stroke, congestive heart failure, kidney failure, or blindness without any warning. And when that happens, we do our best in medicine, but trust me, it is always better to have prevented it than now trying to, put together the pieces. Um, in the US, Dr. Matilda rightfully presented that we have state-of-the-art, amazing medical system, and we will do our best. But this is something that you could have prevented. It is not somebody did voodoo or anything like that. Most of the time, it's not. It's not doing the needful to know that there's an issue to be taken care of and taking care of it. And once you do that, you don't have a stroke, you don't have a heart attack or something, you don't become a liability to your family members and friends. You have healthy life and you enjoy the time the Lord gives you here. Even if it's 100 years, we want you to live it in excellent health. The
Yeah.
Bible promised 120. There's no reason you cannot live 120 years still going up and down the stairs. Papa Jolori, one of my spiritual fathers in Nigeria, when he comes here to visit, he's running up and down the stairs, and I'll be like, Papa, let me go help you get that upstairs. He laughs at me and just navigates the stairs and comes down. Dr. Matilda, am I lying
No,
about Papa Jolori?
no, he's good.
He's good. He's now,
He's
how old is
very
he
good.
now?
He's
Like 100
98.
now?
He's
98.
98 now. Yeah.
He still texts.
Mhm.
And he calls me. He called me, I think it was last month. Even name as the daughter. How
Yeah.
are you?
He's very
He
fit.
still does, sorry?
He's very fit.
He's very fit. He lives in Nigeria. He eats very well. I learned how to change my diet from Papa Jolori, and I've stayed with it. So taking care of ourselves is very important. There's a question in the chat box. Dr. O, should we ask for an EKG at our annual physical? No. EKG is not a routine test. EKG is a test that we do. It's a screening test that we do when there's need for it. Say there's complaints of, irregular heartbeat or even high blood pressure. When somebody has high blood pressure, we do EKG routinely because we want to have the baseline. We want to know what the heart is doing when nothing has happened. Or at that point, when we find out somebody has high blood pressure, we want to see if the pressure had been high enough and long enough that it has enlarged the heart or caused something else to happen to the heart. So we'll get EKG for that reason. So it is not routine. However, there are now EKG machines and all that people buy online. I've been looking to buy one for medical missions and health fairs that we do here, but I want to research first to make sure that they are accurate and we can use them. But I've seen some of my colleagues actually use a wrist EKG. It's on the watch. If somebody can comment on that you can do your EKG with a watch, you can do that, but it's not a routine test. That's an excellent question. So there's another question. What location or locations are the Mediport? Mediport? I don't understand the question. Can you unmute to ask that?
Maybe I didn't quite get the name right. The one, Madam
Madam
CEO
CEO,
was, yes.
it's Bridgeport.
Bridgeport, okay. What
What?
locations are they? I know they're in Nigeria. Is it like
Madam
in the
CEO, no, they're
United
not in
States?
Nigeria. They're
Oh,
actually here
okay.
in the US. Yeah. Madam CEO, Dr. Veronica, are you
Oh,
available?
hi. Sorry. I heard my name.
Yes. So
What's the
she's
question? question?
asking
I'm sorry.
question where Bridgeport is.
Well, Bridgeport is registered here in the United States and
Okay.
also in Nigeria.
Yeah.
Right,
The-
I think I heard that.
yeah, the properties that the communities we're working with and working on right now is in Victoria Island, Ikoyi, and Lekki area.
So basically in Lagos. Okay.
Yeah, it's in Lagos now.
Okay.
For
Thank you.
security reasons and stuff, we're sticking with where we have control.
And we can follow up with you if you give Dr. O your information so we can even give you more details.
I'll share that with you. Is that okay?
Yes,
please. Thank you. Okay.
Okay.
Thanks, Dr. O. And thanks, my
You're
sister.
welcome.
Was that
Thank you.
Dr. Who was asking the question about Bridgeport?
That is Dr. Khadijat.
Yay.
Dr. Khadija, she my friend. She heard everything I said.
She did.
Ma'am, yes, ma'am.
She's very attentive.
Awesome.
Thank you, ma'am.
Thank you so much. This has been awesome. And, straight to the point. I mean, we've had presentations. This one, yeah, I don't know. I like the flow that we could follow easily. It was excellent. Thank you. So,
welcome.
what would be your parting words for us?
My parting words would be take care of yourself while you are alive. From your working life to the end of life, there is a gap. That gap from when you no longer, or I should say, from your working life to the end of life is a retirement life. Between the retirement life to the end of life is almost like do little or do nothing, but live well and live happy time of life. Therefore, to live happy, live well, live at peace, it totally depends on what you did from the working life to that retirement life. Let's take care of it. Let's put all the plans that we have to put on now, put it down, so that from our retirement life to the end of life, we actually enjoy ourselves to death. We shouldn't, don't plan to die without planning to live well before you die. That's my parting words.
I love that. Don't plan to die before planning to live well. That's
Wow.
profound. Does anybody plan to die?
No.
People plan to die with their behaviors. When they eat like no tomorrow or drink like no tomorrow, no exercise, no care for self, not checking to see if there are underlying disease entities they need to take care of. Actually, that is planned for death. And maybe not even a pleasant one. We just don't think about it. Thank you so much. That was profound.
Thank you.
Well said, Dr. Matilda. Plan to enjoy life when you retire. Yes.
You should plan to enjoy life when we retire.
And
not retire because we're in pains. And then we need somebody to help us here and there. Let's retire and then actually enjoy life.
Yep.
You know, enjoy. Otherwise, we are working to leave everything for the kids who probably, I don't know, they may not have the value and respect for what they are handed over than the person. They may not have the proper respect and value for it like the person who worked and labored for it. I see it all the time in my field of work. Yeah. When it's time for their parents to go, some children are like, hurry up, like some want the mother or the father to go. And the parents get to the point where maybe they are debating between put them in hospice or don't put them in hospice. And some kids are like, put him in hospice. And some kids are like, no. You know, we have one that was put in hospice and the mother and the woman would wake up in the morning and say, they put me in hospice, I'm going nowhere.
I love that.
I'm going nowhere.
Yeah,
They think
right.
I'm going to die. I'm going nowhere. And she will sit up and eat up all her food and everything, you know.
Yeah.
She's still enjoying her life here. Please leave her alone. And so let's actually, we suffer so much to work during the work life. We labor. After retirement is that small gap between retirement and end of life. Let's actually enjoy life and not leave ourselves in a condition where we can no longer enjoy life. We jump from retirement to death, to end of life. That's not fair.
Yeah.
That's not good. Yeah.
True.
God bless you all.
Thank you. And may the Lord bless you too.
Thank
Yeah.
you.
Thank you so much.
Very good presentation.
Thank you, sir.
Thank you so much.
Thank you, sir.
Excellent.
Yep.
Yeah.
You probably need to come back and define what enjoying life means. I know it's on everybody's terms. Yeah, it's on everybody's terms. But some people don't know what that means anymore because they've worked 3 jobs. Yeah.
Okay.
Yep.
So
They
that's
don't know what
another
it
topic
means.
for you.
Huh?
I said that's another topic for her. She has
yeah.
one, so.
Yeah.
Oh my goodness. Yeah. Yes, I can just give you a small snippet of that. Enjoying life by my own definition is you wake up, you are exercising, you are happy to wake up each day, you exercise, you eat right, you hydrate, you have all your documentation, life documentation in place, your finances are wonderful. It's all in place, you have your paperwork in place. It's not for death, it's for the living. You have your legal paperwork in place, your finances, your bank account, you have labeled and documented who gets what. All of that is not at the end of life, is while you are alive. And then you are enjoying the proceeds of your labor. You're enjoying the proceeds of your labor.
You just
So you
described
enjoy.
work, Dr. Matilda. I thought you were going to talk about breakdancing, eating breakfast in bed, and
You can do that too.
Yeah.
Truly, you can do that too.
just kidding.
When you are retired, it's a time for you to do what you want, how you want, when you want, and nobody can question.
Travel. I
Whatever.
was waiting to hear that word, travel.
It's
Travel the
under
world.
doing what you
Okay,
want.
I can take us to Poland next year.
Oh,
yes,
okay.
let's do it.
Yes, we'll talk about it.
Okay, let's talk about that.
Yes,
Yes.
Nice. Okay. Poland, here we come. Thank you so much, everyone. This has been awesome.